Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your town moderator. We're here each Wednesday at noon for this update, and this forum is being brought to you live by PAC TV. We're on Comcast Channel 15, Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Representative Matt Muratore and me include Dr. Barry Potvin. He is chair of the Plymouth Board of Health. Also, we have Joseph Murphy, and he is principal of Plymouth South Middle School, and also Amy Naples. She's the executive director for the Plymouth Area Chamber of Commerce. And we're going to begin with our opening with our own state representative, Mathew Muratore. Welcome, Matt. And unmute yourself, Matt. There we go.
I'm new at this, sorry.
Yeah, it's show number 92, Matt. Okay.
You know, it's funny, see, I'm doing a League of Women Voters event tomorrow night, and they had a practice test last night for the Zoom. And I didn't think I needed it, but I guess I do. So listen, so the positivity rate, as we know, is still creeping up, much better than still it was at the beginning of the year. But you know, the governor is looking at us on a daily basis. We're at 2.55%. I know Barry will talk, Chairman Potvin will talk a little bit more about Plymouth. You know, Plymouth is high, much higher than that, almost 3 times higher than that. You know, so there is some concern that this is still going up. A lot of it has to do with a lot of different things, including the weather's getting better. Spring break has happened. St. Patrick's Day has happened, but now we got Easter and Passover coming up as well. So there's a lot more gatherings. When you start looking at the breakdown of where these events are happening, these COVID events are happening, it far exceeds it in households. If you look at from February 21st to March 20th, these are pretty exact numbers. 15,000, almost 16,000 cases were from households of COVID-19. The second most was from childcare centers at 298. So you see where the problems are really happening. And I know Plymouth is doing a good job with getting the bachelors are back out again. I know Barry will talk about that. But we still need to be vigilant. We can't let our guard down. I know the spring is coming and people are getting excited about getting out and the vaccines are getting up, but we still got to continue to do our part because there is still that concern that as the governor's looking at these numbers daily, that we could be put back even further and get out of phase 4, phase 3, and maybe go back to phase 2 if we have to. So we don't want to go back and get more things closed down, but if we keep going in this direction, that may happen. So let's hang in there a little bit longer. Let's keep wearing masks, keep social distancing, and you know, the next 3 months we'll get everyone vaccinated.
Troy, he'll be with us and our panelists today. We're going to go right to our medical segment. And as Representative Muratore indicated, we have today Dr. Barry Potvin. He is chair of the Board of Health. And Barry, I know that you've been monitoring Plymouth in particular. What do you have to tell us today?
Well, quite a lot, but I'll try to do it as quickly as I can using a PowerPoint presentation, Steve. So I'm going to go straight to that so that you can see what's going on. And make sure that I've got the right thing going. Okay, so this table is done on a weekly basis. And as you look down through the dates here, you'll see that Plymouth did go from red to yellow, and we were yellow for 2 weeks. And then if you look at the most recent data, you see that our a positive case number went up from data from the 7th of March to the 20th. Our average daily positive case rate went up to 36.3. And the positive test rate is 6.35, puts us firmly in the red. Same thing that happened last week or a week earlier. And you notice that things seem to be doubling from what it was when we were originally yellow. So this is a graphic presentation of that data. And you can see that for the past 2 or 3 weeks, we're showing an increase once again. This is apparently something which is going to continue at least for another week when we get the data on Thursday evening from the state. We are one of 32 red communities in the state, and at least 5 others are on Cape Cod, and there's, I think, 2 or 3 others that are part of Plymouth County. This shows you what's really bothering me the most. This is a comparison of town of Plymouth to other Massachusetts red communities. And you can see that with our 6.35% positive test rate, that puts us 3rd worst in the entire state of Massachusetts. The only ones that are currently worse than us are Barnstable and Yarmouth over in Barnstable County. There are some other red communities in Plymouth County and Barnstable County, but they're not 6.35 or above. If you look down at the state level, that's 2.01%, which is their percent positive test positivity. Barnstable County is the 1st worst on that, and Plymouth County follows directly behind. So this, needless to say, is extremely troubling. And I really believe that the state needs to pay some pretty strong attention to these numbers. And remember that we are apparently having an outbreak here in Plymouth. It goes along with the outbreak that they're seeing out in Barnstable County and Barnstable and Yarmouth. This was done by our academic group, and they've done the display in a different way, but it just shows you the same sort of data. And it shows the start of the increase that occurred 2 or 3 weeks ago, and it's continuing. This is the COVID data for the US, for Massachusetts, and for Plymouth. And you can see the numbers, 30 million or so in the US cases, 547,000 deaths. Massachusetts, 595,000 and 16,808 deaths. And Plymouth is 4,417. 150 deaths. The good news about this is that because we have such widespread vaccination in the oldest age groups, the death rate is not increasing. So the death numbers are pretty much flattened out. And we expect that that'll probably stay the same because we've got a lot of our elderly high-risk people already vaccinated. This shows you the CDC data in terms of age groups. And the same thing is happening in Plymouth. We now look through this and we see that the largest group for the percentage of cases is really occurring in the 18 to 29 year age group. And we're seeing the same sort of thing, so it's very different than it used to be. These are the variant data, which are up to date as of today. And you can see that that UK variant, which we actually talked about at the school committee meeting earlier this week, is 686 known cases in Massachusetts at the moment. There's 11,569 of them in the United States, and we know of at least 2 that are in Plymouth County. The South African variant hasn't caused a lot of trouble. It's pretty much stayed flat. The Brazilian variant is now up to 37 in Massachusetts, 172 in the US, but the outbreak they're having in Barnstable County seems to be caused, at least to some extent, by this Brazilian variant. And they've reported about 20 of them that they found in Brazil. So these strains are all probably about twice as more infectious and easily transmitted as the original strain. And there's been reports that the UK strain may be much more frequently found than what you see here, just because of the way in which the testing is being done. In some cases, they think it may explain about half of the new cases. This is our vaccination data. Again, this will be updated as of Thursday evening. And if I call your attention down here to the 75 plus group, you can see that they have received 1 or more doses of the vaccine. And 1 dose will render you about 80% resistant. And 2 doses would render you about 90 to 95% resistant to the infections. Close behind them are the 65 to 74 year age group. 71% of them have at least 1 dose. And you notice that 23% are fully vaccinated in comparison to 75 plus year group where 61% are fully vaccinated. These numbers are changing rapidly. If you look at the statewide numbers, you notice that about 16% of the population of Massachusetts is now fully vaccinated. However, in the town of Plymouth, This is going to be about the same as that. This is the number of vaccinated Plymouth, Massachusetts residents. Fully vaccinated are in purple, partially vaccinated, which means one dose only, are in the blue. And you can see it does vary, as you would expect, between age groups. Remember that the 75 plus were made eligible first, followed by the 65 to 74 year age group. Very recently, they got down to the 50 plus age group. And so those numbers are increasing. And you can see that 15% of the residents in Plymouth have received at least one dose, and 16%, as you just saw, are fully vaccinated. So those are the numbers that I wanted to share with you. I tried to do it as quickly as I could. But the bottom line for all this is that, yes, Plymouth is having a problem. Plymouth is having what seems to be an outbreak. We don't have any pop-up free testing sites here in Plymouth. And in terms of vaccination sites, I think most of the Plymouth residents, myself and my wife included, are depending upon the pharmacies, which are supported by the federal program, to get most of our vaccinations in. Some people are also traveling quite some distance to get to the mass vaccination sites. A new one just opened at the Hines Vaccination Center up in Boston. For those that want to go there, you should know that they will allow you to park there for 2 hours free of charge. And they have a massive amount of vaccine that's coming in, because at least 6,000 doses are coming in from the federal government directly, and another 1,000 from the state supply. But again, it's a distance. You have to drive a ways to get there. I know that one of our Board of Health members actually drove all the way out to Springfield, Massachusetts to get his vaccinations twice. So that's quite a long round trip. So that's all I have to share with you right now, but I'll be available to answer any questions that come in. Thank you, Matt.
Thank you, Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. He's here to answer your questions. Send them to plymouthinfo@pactv.org. And now we're going to go to our education segment. And today, for the first time, we welcome Joseph Murphy. Mr. Murphy is the principal of South Middle School. Welcome, Joe.
Thanks for having me on, Steve. I thought I'd take today's time and just give everybody out there an update on some of the steps that we've been taking down at South Middle School in preparation for all the students to return on April 12th. For those of you who may or may not have been paying attention, that was a decision that was reached fairly recently by a school committee. There was also some direction from the Department of Education that middle school students needed to return by April 28th. And so Plymouth will be ahead of that timeline. The nice part about doing all of this, having been notified ahead of time, which is very different than I think the way that things played out in August in the return to school, is that we've had more time to pivot and to make the necessary preparations for the return of all the students. I think we're feeling really good, really comfortable and confident. Our elementary students returned this past Monday. In the middle school and high school students will be coming back on the 12th. And so what we've done, I think at South Middle School, but I think most of the schools, to be frank with you, is we've sort of taken a step-by-step approach to get ready to have all students return and following all the guidelines so that the return is not just safe, but hopefully seamless. So, several weeks ago, I approached a group of teachers in our school, and I told them I'd like them to pilot having the increased amount of furniture in their room, or sort of pressure test, very similarly to the way that we did back at the end of the summertime, with still half of the students in the school. And we would learn from that situation, learn about best practices, and then use some of those things that we learned to teach the rest of the staff. And I had a bunch of 8th grade teachers step up. They did that. They did a job very, very well. And I was able to take some of the suggestions that they had about student traffic in the floors and the hallways throughout the course of their classrooms. And we were able to apply a lot of that throughout the rest of the building, which was great. And so it took about 2 weeks for us. We took a slow approach to get all of our academic classrooms set back up with furniture, to orient the students to that furniture, And it's, some of the teaching practices had to change slightly because there's less room in the classrooms, even though we still don't have all the students back. And so the teachers have done a great job with that. After that, we took a look at some specialty spaces within the building, places like art rooms, computer labs, the library, things of that nature that, they're not like a typical rectangular square space. And I was working with our custodial staff and our teaching staff on like, how do we best utilize this space for teaching, but how do we also keep it safe and follow the guidelines? And so that was the second phase of all this. The teachers were great. Our custodians, I can't say enough about all of the work that they've been doing in terms of keeping the schools clean, sanitized, working with the teachers, moving furniture. There, in some ways, I would say that the custodians and the school nurses are really unsung heroes of making school function this school year. So they've been wonderful. More recently, about a week ago, we really had to look closely at our science classrooms. If you went to school yourself, you probably remember doing science labs. Science is really hands-on, and the furniture in those classrooms is usually really large tables. And so we had to get creative in how we were able to do that, look around our school, look for the right kind of furniture, and our science teachers were great. So we've been able to make those rooms safe, make it so that they function, so that the kids can learn hands-on as well. And so I think we're in a really good place in terms of the preparation of the space and the furniture in the building coming back. Last week, we changed our traffic pattern. As you probably could imagine, there's a heck of a lot more families that are dropping their students off as opposed to taking the bus this year. It's a personal choice of comfort, which is fine. But to accommodate for that, I had to switch around where our staff was parking to accommodate for all those extra drop-offs in the front of our school and in the increased foot traffic of students crossing from our front parking lot into the building. And so we were able to do that fairly seamlessly. We had the support of the Plymouth Police and our school police officer to help with that. We were able to communicate out in advance to families, not just in writing, but with visuals and calling their homes and so on and so forth. And so that went very smoothly last week. So we're ready for an increased number of cars come April 12th. We're using multiple entrances and exits at the beginning and the end of the school day. We're keeping the kids spaced out, and I think we're in very good shape in that regard. More recently this week, we made another shift in preparation for all of the students returning. And this was a bit tricky as well in regards to lunch. And so the thing that made lunch a little tricky was that when the students removed their masks to eat, they still need to keep 6-foot spacing and distancing, where some of the recent guidelines from the Department of Education has said that students can have 3-foot distancing in their classrooms. And so we had to look at our biggest spaces within the building. So what we've done is we've set the cafeteria up where we have about half our students for each lunch eating there. And then we're utilizing some of our other large spaces where we can keep that distancing, keep the space clean, keep the students safe. So we're using our library, we're using our lecture hall as well. And our cafeteria workers have been great. They are not just feeding the kids in the cafeteria, but they're sort of, think about like a food truck. They're sort of like mobile food folks within the building, and they're taking all the meals and they're taking the food and the drink and they're bringing it to the students. And they've done a great job in supporting all this change as well. Finally, I think the last thing that's probably worth mentioning is that maybe our largest space in the building is our gym. And so our phys ed teachers have done a fantastic job of finding ways to keep the kids active while still keeping them spaced out safely. Some of the regulations regarding students and physical fitness is that the spacing is even greater. It's a 10-foot marker in terms of the distance. Rightly so. I mean, a lot of times the kids are, they're working up a sweat and they're being active. And so that extra space is called for. And so we put plans together so that, I guess as the students return, we have increased numbers. There's going to be a concern with the space. And I think that we're able to handle that fine because of our outdoor space. We're lucky we have a soccer field right outside of our gymnasium. There's plenty of space there. So the concern has been, what happens if we have a day with inclement weather? And so how do we give the kids some choice and some activity? So we're lucky because we're able to use some of those other spaces in our building. We do have a fitness room. We'll be utilizing that where we can space some students out in there. We'll still be using the gymnasium, and then we can use our lecture hall as well. And so it's just a testament to the teachers, and it's a testament to all of our staff of being creative and thinking on their feet and coming up with the solutions once they understand the guidelines. So I would say that one other thing that's probably really nice to share is that the tenor in the building, in our building at least, I think it's positive. The teachers are ready for the kids to come back. I think that those staff members that maybe have been affected by COVID or have been worried about COVID and becoming ill, some of that's starting to subside a bit. The morale in the building starting to feel more positive, and I really feel like I can directly connect that back to the fact that the educators are now getting their vaccinations. Some folks are fully vaccinated. I've talked to some teachers who were able to get the one shot Johnson & Johnson. I think that there's a tremendous number of our staff right now that have probably received one out of the two shots, and in the next probably I'd say about 2 weeks, most of those folks will be receiving their second shot. And so that's an update from the school systems. We will be ready for April 12th. We're excited to have the students back. And we're looking forward to seeing all their faces.
Thank you. And that's Joseph Murphy. He is the principal of Plymouth South Middle School. He's available to answer your questions. Send them to plymouthinfo@pactv.org. This time we welcome back Amy Naples. She is the Executive Director, Plymouth Area Chamber of Commerce. Welcome, Amy.
Hi, Steve. Great to see you as always. So today's weather is just beautiful, and spring is certainly in the air, and outdoor dining is happening. We are so excited to hear that the Plymouth DPW will be placing barriers, and the fire department will be filling those tomorrow. So this week, the bump outs to allow restaurants to set up their dining establishments in the parking spaces along Main and Court are happening. We will also be seeing lots of outdoor dining in various areas of town. We know patrons and restaurants are super excited to see this. But I also just want to remind everyone, people do need to continue to remember that COVID is still a very big presence in our community. We need to continue to wear masks, socially distance, and do our part. Because our businesses need us to do so to be able to stay open and continue to be reopening in larger capacities. So this is so great for our restaurants, and it also increases our employment as well. And with that being said, the largest challenge we are hearing from small businesses that they're faced with right now is employment and trying to find employees to fill open positions. So the Chamber, along with our partners at the Plymouth Recovery Task Force, are working to identify opportunities to fill these roles. We are working with our higher education partners on training and just doing outreach to their students, just trying to fill these roles. So anyone who is tuning in today and they know of somebody looking for a job, certainly reach out to us. We can pair them up with a local restaurant, retailer, hotel that are looking to fill those positions. We are compiling a list of all of those positions, so that way it's easily accessible for those looking, students returning home from college, as well as those who are unemployed. So we're hoping that we can do all we can to fill those gaps that we are seeing. And as you know, Easter is this weekend. And of course, the Chamber has your guide to Easter dinner. The Chamber's put together a guide for each holiday, and certainly Easter is one we'll do as well, or have done as well. So we've compiled a list of all the Easter menus from our local restaurants. So that way it's easy for you to support a local business and select a great Easter dinner. So you can view that on our Chamber Facebook page. The complete list is there. For some reason, if you're not on Facebook, which you should be and be following us, reach out to the Chamber. You can certainly call us at 508-830-36 1620, and we will get that guide to you. In addition to planning your Easter dinner, hop on over to Village Landing Marketplace to finish up any Easter bunny errands. On Friday, 2 to 4 p.m., they are having a little Easter egg hunt at the marketplace. It's just a great fun activity for kids. And I just wanted to mention it today because we're always looking for great activities, right, to get out and then check out all of our amazing town has to offer. And we know chocolate bunnies are certainly an Easter tradition, and we have so many great shops in the area that have some of the best chocolate, right? Fidel's, Kilwin's, Cupcake Charlie. So be sure to grab your sweet treats. And other news I wanted to mention today, beginning on April 6th, the SBA is expanding its economic injury disaster loan program, announcing that small businesses who originally took out an EIDL loan for up to $150,000 for 6 months can extend that loan for up to 24 months and also receive additional funds for a total of potentially up to $500,000 in relief. And any new EIDL loan application will automatically be considered for up to $500,000 to cover 24 months of business. This is another great relief opportunity for our small businesses. And if there's any business joining us today would like some assistance or has any questions or looking for other grant opportunities, I encourage them to reach out to me. I'm happy to help them along with the process, connect them with folks who may know more than me or local bankers that can help them with the application process. So as always, I'm easily accessible. I have an open door policy. Stop by the chamber office at any time. We are located on 100 Armstrong Road in the industrial park, or certainly you can visit our website, plymouthchamber.com, and connect with me that way. We are gearing up with lots of great networking and special events as we reopen. So I do encourage you to join the Plymouth Chamber email list. All you have to do is go to our chamber website, click join email list, and you'll stay up to date with all the happenings. And of course, follow us on Facebook and Instagram. As always, thank you, Steve, for allowing me to provide the business update today.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. She'll be staying with us to answer your questions. We do have questions today for all of our panelists. We're going to begin with Plymouth State Representative Mathew Muratore. Matt, a viewer writes, viewer Mary Ellen, I'm a 71-year-old resident. I do not drive. I have health issues. I do want a vaccine, but I'm unable to travel outside of Plymouth. What can I do?
Yeah, Steve, anybody that's homebound, the Commonwealth is working with the town of Plymouth with regard to getting vaccines to you. I believe it was brought up at the Selectmen's meeting last evening, and they're working out a plan. I think they're going to try to get the Center for Active Living involved as well. So I would recommend that she maybe call the Center of Active Living to make sure they have her name, so that they can be sure that they get a hold of her. And that program should be starting, anytime soon. Maybe Barry has a little bit more on that.
And we will go to Dr. Barry Potvin now to comment on that, but also Dr. Potvin, another viewer writes, do we have any specific information about why the numbers are spiking in Plymouth again? For example, are there any specific spreading events and what should we know about? Dr. Potvin.
Yes, thanks, Steve. So one of the things, the question that came in about the homebound individual, Plymouth has opted to use the state system. They have already started to travel around the state to provide in-house vaccinations. And all that you have to do is to make sure that your name and address is registered with the state. And there is a way to do that. And I'm sure that the Center for Active Living can certainly help you with that. It may take some time. There's quite a number of mobile vaccination vans that are going around the state. They're working their way through quite a large number of people that they have to visit. They will be, I believe, mostly giving the Johnson & Johnson vaccine so that you only need one shot. But certainly that, the people in Plymouth can be rest assured that eventually they will get to you and you will receive a vaccination in your home as long as you're eligible and truly homebound and can't go out. That's important that people know that, and it is underway at the moment. So other things that I wanted to bring up certainly involve what's going on in Plymouth and where are these cases coming from. There was a significant number of cases that popped up at a group substance abuse treatment center here in Plymouth. There were some other cases that popped up, I think, in at least one daycare center. But it looks just from anyone that walks around downtown and on Water Street on Thursday through Sunday nights or during the weekend days, when there's an awful lot of people here when the weather is nice, that it's quite obvious that we're getting bigger crowds, which is great for the businesses. Having been there last weekend myself, I did stick my head into a couple of businesses quickly. I quickly left because I noticed a huge crowd of people right inside the entrance door, really close together, many not wearing masks, and I felt that that was a big risk. So what we're going to be doing is our COVID ambassadors are going to be checking for those kinds of things. Obviously, if there's people waiting to get into your establishment, they need to wait outside your establishment, and they need to form a line so that each person is separated by 6 feet, even in the outdoors. And when they enter, except when they're eating or drinking, obviously they must be wearing face coverings. It's essential that we do that. And again, if you look at the numbers that seem to be concentrated in the 30 and younger age group, that's the same group that you can observe crowding together, pretty much ignoring some of the safety protocols. And it's really partly, going to be the responsibility of our COVID ambassadors to try to get a grip on that. And it's partly going to be something we have to ask the business owners to be aware of and to monitor those entrances very, very carefully to make sure that that doesn't happen. So in terms of other things, you may wonder why I'm so concerned at the moment. Well, in terms of vaccinations, Barnstable County is doing the best, and Berkshire County is second best in the state. Why is Barnstable, doing better than Plymouth County? Well, one reason is that Barnstable obviously has a county health department, which helps them. They also have a regional collaborative, which we don't really have operating very well here in Plymouth County. And I think that, we need to pay some attention to that. We need more vigilance on the part of everyone, especially the 30 and younger age group, at least continuing through April so that we can get more people vaccinated. And that's going to happen very rapidly, I hope, during the month of April with increasing supplies. That'll do two things. It'll stop or at least slow down the new variants that are popping up, which can be very, very threatening. And obviously it'll start to slow down the community transmission, which is a problem not only for people out in the community, but especially for people in the school system, which we worry about constantly. The schools are doing a fantastic job. I think the schools are a very safe environment for our students, regardless of the grades. And I think that, you don't really have to worry about what's happening at the schools at the moment. We do have to worry about what's happening in community transmission. So basically, we need more cooperation, at least for the next 4 weeks. Be very careful about being anywhere in an indoor location close to other people, especially if they're not wearing masks. And we'll do everything we can on the Board of Health and the Department of Public Health to try to keep this from getting any worse than it is and start to improve it so that we can move back into phase 4, step 1, and hopefully go beyond that so that we can get back to a more reasonably positive sort of situation for the town of Plymouth. Thank you, Steve.
Thank you, Dr. Barry Potvin. A question for Joseph McCarthy. Viewer writes, the high schools, we understand, are returning on April 12th, and people are expressing concern about students not having a lunch break. Will snack breaks be built in the schedule for all students? Joe McCarthy.
Yeah, that's a really good question. So I think that is a question that really, it's probably best looked at through the level of the school. Elementary school students typically always have a snack at the secondary level. And what I mean by secondary, we're talking middle school and high school. What's fairly typical when we're talking about non-COVID times, that 6th grade students, even though they're in a a secondary school, they're still considered elementary school students in many ways. And so there's a snack time usually built in for them. Our 7th and 8th grade students don't typically have that unless there's some sort of a real need there, whether it's medical or otherwise. And as far as the high school goes, they don't typically have snack time. And so let me speak to middle school because that's what I know best. I've had some conversations with my 6th grade teachers about that. We're working on finalizing some plans so that if students do want to have a snack, that we can do that safely. I think it's going to end up involving the need for the teachers to rotate the students in and out of a space. Because with all of the students returning into a classroom, it's very challenging to have the 6-foot spacing, which is a necessary component to keep them safe. And so we will be doing that. If there's any need for students in grades 7 or 8 to have a snack, we'll make those accommodations for those students as needed. We do always have students that have nutritional concerns, and they either like step out of the room, they go to their guidance counselor, they go to the nurse's office, things of that nature. So we will continue to do that. As far as the high school goes, I believe that there's a plan in place, and I'm not as well versed on that, but I believe that there's a plan in place for the students to attend classes in the morning, and then they do have the option to have lunch either at school or take it home with them, or leave school and go home and eat. So there will be that piece there. The other piece that's probably worth mentioning, which I'm not sure if it was mentioned in the question, Steve, but there's the piece about breakfast. We do have a pretty substantial percentage of our kids who are eating breakfast. The federal government passed some legislation this year where all lunch and all breakfasts are free of charge to students. And so I think particularly with the breakfast piece, we've been serving more breakfast than we typically would. And so we're finalizing the plans on that as well, on whether or not students will be rotated out of their classrooms with the ability to eat their breakfast first thing in the morning, or I'm also looking at having them stay in the cafeteria, eat, and then go to their first period class. And so it's really probably the final step of preparation for the return of the students. It's a great question. I'm not too worried about it because we do have different options. And what I need to do is to ask our cafeteria staff and our teachers to look at these two possible solutions as well. And we have plenty of time before we get to April 12th to finalize that plan as well.
Thank you, Joseph McCarthy, Principal, South Middle School. And next week, we will have Patricia Fry, and she is the principal for Plymouth South High School. So again, we'll get that high school perspective. But now we're going to go to Amy Naples. And Amy, we have a question from a viewer. If the spike in numbers continues, will that impact outdoor dining? And do we have any more information right now about any summer events planned for Plymouth?
So I would have to refer to my friend Barry Potvin or Matt Muratore to answer that, but I would assume that it would not impact outdoor dining. That may impact indoor dining and the capacity. But that would be up to the Board of Health for the town to decide that. In regards to outdoor events, we are super hopeful to have special events and outdoor events. And I know the Plymouth 400th is hopeful as well. However, we have not received the go-ahead to start planning for those. So those are still to be determined, but we are hopeful as vaccines roll out and more people are vaccinated that we will be incorporating festivals and special events into our programming.
Thank you. And now we're going to go back to our panel for your closing thoughts. We're going to begin again with Dr. Barry Potvin. And Dr. Potvin, if you could incorporate in your closing remarks a further response to what might happen if there's a continued spike in numbers, will that affect outdoor dining?
Yes, I can do that. I believe that outdoor dining is vastly safer than indoor dining. I myself, I've now received the second dose of vaccine. Even before that, I was always perfectly comfortable engaged in outdoor dining at some of our downtown restaurants. Didn't really worry me. The tables were separated adequately. Everybody was obviously practicing safe practices in terms of wearing masks, except when they're eating or drinking. So I don't think that's going to change. Indoor dining could, but so far it hasn't. Again, it's my belief that outdoor dining is almost completely safe as long as you don't do anything really silly. And that indoor dining does carry more risk, but everybody has a different capacity to tolerate risk. At the moment, about 50% of the people in a survey I saw felt that they were completely okay with indoor dining. And 50% therefore are not. And a larger percentage felt okay with outdoor dining. So in terms of last minute takeaway messages, I think that we should take a lesson from the schools, and I hope that the state will provide us with a means to do more free COVID testing. The schools are using a saliva-based PCR test, which is optional, but it's very, very accurate, and it doesn't require any of these deep nasal pharyngeal swabs. And I think people would find it pretty easy to do if we had the kits to be able to give out to the general public when they needed them. So I'm hoping that we can get some assistance from the state, and I'm hoping the state DPH and Governor Baker will give another look to what's going on in Plymouth and come across with some additional assistance for us. Thank you, Steve.
Thank you. And that's Dr. Barry Potvin. He is chair of the Plymouth Board of Health. We're now going to go back to Joseph McCarthy. He is principal for South Middle School. Joe, each week we ask our panelists to give us your closing thoughts.
Sure. Matt's smiling because we know each other. My last name is Murphy, but it's fine. I'm happy that you're having me here, Steve. I do have a couple of closing thoughts, and a lot of this is in regard to the mental health and the well-being of kids. Some of you out there that might be watching, if you have your own children that are school-aged, or you have grandchildren, you may be aware of some of this, or you may not be. Our kids in Plymouth and across the state and across the country have really not had a very, what I would call a probably healthy routine over the course of the last year. Kids need to be surrounded by dependable people that are going to give them the kind of support that they need. And I think the schools typically do a very good job of doing that way beyond academics. And because we've been out of school for safety purposes and we've had a hybrid model, our students are not in what I would call like a typical or healthy routine. And one of the things that we have seen, and I know Dr. Potvin, and I know Matt also serves on this. We monthly we meet as a collective organization. We talk about the mental health of people in Plymouth County, and there is this expected rise in unreported mental health issues. And I think that getting students back to school in a good routine, getting to bed early, making sure we know we can feed them breakfast and lunch, that they are getting the kind of not just academic support, but mental health support, all those social interactions that they may have been missing out on over the course of the last year. I think it's going to be very good for the mental health of our children in Plymouth. And so it's a piece I wanted to make sure that I got in there and shared, because we're not sure what the final outcome of all of this is going to be on the mental health of kids in the community, but I think that this is a step in the right direction. I'm very encouraged by our track record in the school system and keeping staff and students safe. If we compare the numbers in the schools to the greater community, they're very encouraging. There've been a lot of studies that the Department of Education has released recently with how safe 3-foot spacing is compared to 6-foot spacing, and like the difference of infection is negligible. So I think that we're ready, we're excited, and I think it's going to be a good thing for kids. I think it's going to be a very good thing for families. The fact that many families have had been disturbed in terms of their routine, their ability to work, and the way that they carry on because their kids aren't in school every day. That's another nice benefit to this. So we're really looking forward to all the kids returning, because it's going to be a great help, not just for those kids, but I think for families as well. And so we're really excited for April 12th.
Thank you. Joseph Murphy, the principal of South Middle School, and Joe, we'll just add that to our list of bloopers. We're at show number 92, and we've got plenty of them. We're now going to go back to Amy
Thank you.
Naples, Executive Director, Plymouth Area Chamber of Commerce. Amy, your thoughts?
Thank you, Steve. Of course, I just want to extend a thank you to you, Steve, Representative Muratore, and PAC TV for providing this informative program each week. It is absolutely crazy to think it's number 92. I've only been here for, many, don't get me wrong, many, but you all have been here all 92, and it's truly amazing. I continue to learn from my fellow panelists, and I just know how valuable this program is and the information that's being put out there to our residents. I hear this all of the time. So congratulations to that, and thank you for putting all of this time and effort into it. It is truly appreciated. It is so great to see my old friend Joe Murphy joining us on the panel today. I want to commend what the Plymouth schools are doing to ensure the safety of our students. It's truly an incredible job. You've left no stone unturned and should be super proud. And as I told Joey earlier, I'm excited to see school buses and be stuck behind them. It's so great to see, and our community is so lucky to have these leaders that are doing all they can. But in closing, I just wanted to report that the town of Plymouth is participating in the Massachusetts Local Rapid Recovery Program to help communities develop plans for targeted downtowns. And the town of Plymouth has paired with an amazing consultant. Lee Hartman, Stephen Cole, and myself met with him for about 2 hours last Friday. And he will help us develop a plan that meets the needs of our small businesses and our local businesses and help us determine future policy decisions. This is going to be a tremendous help. The area of concentration is the downtown Plymouth Harbor District, so downtown and the waterfront. I did want to share this because this is an amazing opportunity for our business community and, of course, the recovery efforts for our town. And thank you, as always, Steve.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Amy, you're certainly right on in terms of the feedback that we get as we prepare for Plymouth Town Meeting. I've been getting feedback from town meeting members. In fact, one of them filed a motion to amend a main motion, and in his supporting arguments, he mentions our program. He mentions how important it's been and how much it's helped him throughout the past year. So again, a reminder, Plymouth Town Meeting is this Saturday. It will be remote. We'll be coming to you live from PAC TV studio beginning at 8 a.m. this Saturday. Next week, Matt and Ken and I will be joined by Dr. Philip Triffletti, who will be providing a medical update, and also Karen Keene. She's the Director of Public Health for the town of Plymouth. She'll be updating our numbers, and again, Patricia Fry from the Plymouth Public Schools. At this time, we're going to go back to Plymouth State Representative Mathew Muratore for his closing thoughts. Matt.
So as you see, Steve, I have my not Corona today hat on. I did that for Dr. Potvin. So we're trying to will the coronavirus to get out of Plymouth altogether. So I think that, coupled with the fact that we're seeing more and more vaccines coming to Massachusetts so far. We've had over 4,000 vaccines delivered to Massachusetts. Almost 86% of those have gotten into arms of people. Almost 20% of those people are fully vaccinated in the Commonwealth at this point. So there's a lot of hope. But again, as everyone has said, we still need to be cautious. We don't want to go backwards. We want to continue to move forward. I also wanted to remind people that you can pre-register for the vaccination. And even though you may not be coming up until later on in May or June or something, you can actually just go ahead and pre-register if you want now. Starting Monday, everyone age 55 and older with one medical condition can now get the vaccination. And then on April 19th, everyone will be able to get the vaccinations. Also wanted to remind people that the president last night, or yesterday afternoon, I believe was, extended the PPP loan money for small businesses. So they're making it even easier. So if people have not got that PPP loan because you didn't think you could qualify for it, I would encourage folks who, if you haven't got it, to go after it. The money is still there, and they're extending it. They're trying to make it as easy as possible. And one last thing that's happening, unfortunately, when we have these type of situations, there are a lot of scams that are out there as well. The Attorney General has put out a notification to remind folks that nobody's going to give you a prize for getting a vaccination. There are scams out there where folks are getting emails, you just registered or you just got a vaccination, and click here to redeem your prize. You are not getting a prize to get vaccinated. The prize will be that we'll all be able to get together with our loved ones and friends and get back to normal. That will be the prize. So I want to wish everyone a happy Easter, and we will see you next week, Steve.
Yes, thank you, Matt Muratore, Plymouth State Representative. And again, as Matt said, we'll be back here next Wednesday. And in the meantime, on Saturday at 8 a.m., Plymouth Town meeting. We wish everybody happy holidays. I'm Steve Triffletti, Plymouth Town Moderator. Good day.